Hi and welcome to this edition of Dr. Skolar's Chiropractic Health and Wellness Session. We're going to be talking about a very important subject today that involves spinal restrictions and its impact on your health. So typically, when we perform a spinal evaluation, we like to have our patient lie on their belly, and we're going to systematically go from one vertebrae to the next to determine and to assess proper spinal mobility. And this is important to do because if the vertebrae are not moving properly, this will put a great deal of stress and tension not only on the muscles that attach to the actual vertebrae themselves, but it can also put excessive compression on the discs that are found in between each vertebrae, as well as on the delicate nerves that leave each level of the spine. So this is important because we know that the nervous system, specifically the spinal cord, and the peripheral nerves, the nerves that leave at every level of the spine, are found at the level of the vertebral column. So if there's any excessive tension or abnormal biomechanical functioning of the vertebrae, this can cause not only local problems at the level of the spine, but it can also cause problems elsewhere in the body where these nerves are ultimately destined for. So as we go from one level to the next, we're determining spinal mobility. When we find areas that are not moving properly, we very gently stimulate movement with our hands. And this feels really, really good. And there's practically no discomfort whatsoever when we adjust and perform spinal adjustments in order to restore proper biomechanical functioning. And typically, when we work on the mid-back, we like to have our patients lying on their stomach. It's a very relaxed position, and it also gives me full access to work all of the structures in the spine. When adjusting the lower back, or the lumbar spine, when we determine there's abnormal motion at this level, we like to have our patient turn on their side. Just turn on your right side, please. So an adjustment of the lumbar spine would look something like this, and it's really, really comfortable and extremely, extremely effective for the patient. Then, hand out. So a slight pressure to the lower back, in fact, will adjust the vertebrae and stimulate motion at that level. So this is what spinal adjustment looks like at both the level of the mid-back and the lower back. It is extremely therapeutic. It is a very powerful procedure. And for more information on this, I can be found at www.drscholarchiro.com or at 514-707-2222. Thanks and have a great day.